Okay, so we're at 2:01 and I think it's time to start the seminar. Welcome everyone and thank you for joining us as we wrap up the semester together. My name is Alexandra and I have the pleasure along with Dr. Dana Carroll to host this seminar series. And it's wonderful to see you all here as we close up the year with a really exciting talk. And in the spirit of the holiday season, we're ending on a sweet note. And this is quite literally with a talk focused on sugars and their role in tobacco product toxicity. And our speaker, Eleanor or Hansen, brings a unique blend of scientific expertise and a strong public health mission. She began her career in food safety and microbiology, where she isolated novel bacteriophages to combat foodborne pathogens. Later, Ali shifted her focus to equally complex and impactful field of tobacco product chemistry and health effects. As a PhD candidate in the environmental health sciences at the University of Minnesota, Ali investigates how sugars and other additives influence cigarette toxicity. Her work combines advanced analytical chemistry with clinical research to address critical regulatory questions. Beyond her lab, Ali has done remarkable detective work. She delved into the internal tobacco industry documents to uncover how tobacco companies studied and framed the toxicity of sugars and other additives in their products. Outside of the lab, Ellie is a passionate advocate for community-engaged science. She has led many outreach efforts, mentored high school students and undergraduate researchers. As the president of the Twin Cities Science Policy Network, she works to bridge the gap between scientific evidence and policy action. And on a personal note, it's an absolute joy to introduce Ali, not just as a respected young scientist, but as a dear friend and integral part of our research group. Ali is the one who always remembers the birthdays, brings the coolest snacks on the meetings. She also finds the most thoughtful gifts and shares the most fascinating scientific articles at just the right moment. And her warmth, generosity, and curiosity makes our group stronger, kinder, and more connected. So everyone, please join me in welcoming Eleanore Hansen as today's speaker.
Thank you, Alexandra. That was really sweet. So today I'm going to be talking about some of my PhD dissertation research that I've been working on. So let's not sugarcoat it and talk about some of the toxicological implications of sugars in cigarette tobacco. So first, I'd like to go through a quick alliterative agenda today. So as many of you know, you've probably seen me do this a lot of times before, but I really enjoy playing with alliteration as a literary device. So you'll have to forgive me if you see it popping up in several places throughout the presentation, but I think it's fun. So anyway, we'll start with a cigarette conspectus, then we'll saunter through a synopsis of the use of sugars in tobacco, commercial cigarettes specifically. I'll outline some of my objectives. I'll highlight the hypotheses behind these objectives, address the approaches and what we found. I'll recapitulate the results for you, and then at the end, we'll have some concluding comments and time for questions. But first, I want to hail back to my food safety background a little bit and present to you a few comics that I find pretty entertaining to review whenever people ask me why I've transitioned from food science to working with tobacco. So the first one you can see here, this man telling his colleague, I still smoke, but I'm careful to buy cigarettes that are gluten-free with no trans fat. And here you can see a dietitian telling his client, presumably, that yes, tobacco is a green leafy plant, but a cigarette does not count as a salad. So while food and tobacco may seem like completely different products and different fields of study, they are highly interrelated as environmental and commercial determinants of health. So with that said, let's consider the case for cigarettes and why we're still looking at combustible products. So a question that I get frequently, and I'm sure many of you do as well, is why are you studying cigarettes? Aren't they old news? I thought smoking was declining. Why aren't you looking at vaping? Or we already know cigarettes are bad for you. What more do we need to know? So while most of us here do research in tobacco, I do want to just remind us of the importance of cigarette use. for public health and the impact it has on public health. So while we know that cigarette use has been declining over preceding decades, we still see that about 11.6% of US adults use cigarettes, so that's about 1 in every 10 people. We have also seen that in recent years, an average of 173.5 billion individual cigarettes are sold in the US alone, and then over $8 billion have been spent on advertising and promotion of cigarettes alone. That's not including other tobacco products, that's just cigarettes. So the industry is still heavily investing in selling cigarette products. We also know that 16 million people are living with a disease caused by smoking in the US, accounting for 480,000 deaths annually. And the most recent actual cost that I could find for the US economy due to this burden of smoking and disease is $600 billion. So we know that cigarettes are still a major issue, even though there are other popular nicotine and tobacco products emerging. So it is still important to consider their public health consequence. And also, as many of us here know and have already studied, cigarette smoke contains many, many harmful chemical constituents, including addictive compounds like nicotine and acetaldehyde, respiratory toxicants like propionaldehyde and acrolein, and then carcinogens such as the potent tobacco-specific nitrosamines, NNN and NNK. And these are all compounds that I will consider in my analysis of the toxicity of sugars in cigarette tobacco. And finally, we also know that constituent levels in cigarette smoke are highly influenced by design features. So the industry has spent a lot of time researching different design features and manipulating them to make an ideal product. However, we can also investigate these to see how those design features might influence toxic exposures for people who are using cigarettes. So specifically in this case, we'll be looking at tobacco and ingredients, particularly sugars, and their role in levels of toxic constituents in cigarette smoke. Okay, with all of that background aside, let's talk about sugars in commercial cigarette tobacco. And specifically, we'll start with how did we get here in the first place? So early in US history, pre-1900s, early settlers of Missouri and Kentucky used to add sweeteners to burley tobacco that they used for plugs, tobacco plugs to increase their palatability. They also found that adding sugar decreased the material cost of chewing tobacco production. So it was kind of a win-win, more palatable and also making things cheaper as well. So this was a very popular product, sweetened chewing tobacco. And the American Tobacco Company was a major producer. However, the 1911 dissolution of the Tobacco Trust by the US Supreme Court ultimately led companies that were broken up and disincorporated to shift their focus. And specifically, R.J. Reynolds Company shifted its focus from manufacturing plugs to manufacturing cigarettes, which were gaining a lot of popularity. And they also needed to use up some of their stock of this sweetened tobacco that they had previously used for plugs, which is when they started incorporating that tobacco into cigarette blends. So in 1913, Camel cigarettes were launched by R.J. Reynolds, and they incorporated these stocks of sweetened plug tobacco as their first American blended cigarette. And then between 1913 and 1921, R.J. Reynolds' output of cigarettes in the U.S. market increased from 0.2% to 50%. So that's a massive growth in less than 10 years. The popularity of these cigarettes, these sweetened cigarettes, inspired other companies to follow suit. They were hoping to replicate R.J. Reynolds' success. And by the early 1930s, the majority of cigarette manufacturers in the US utilized these blended tobaccos for cigarettes instead of single variety tobaccos. And then from World War I and World War II on, these American blended cigarettes continued to be popular, and they gained international popularity as they followed American troops across the world. So essentially, we've seen that sugars have been used as a commercial additive to cigarettes for over a century, and they remain the most widely used additives in cigarette tobacco, and they can exceed over 10% by weight of the tobacco blend in the cigarettes. We also know that sugars are favored because they increase the palatability and appeal of the cigarette and the cigarette smoke. So the compounds generated by thermal degradation of the sugars generate those flavors and aromas that you typically associate with like toasted bread, caramel, those kind of sweet caramelized sugar flavors. And they also decrease the pH of the smoke, which decreases the harshness. So that makes it more easy or comfortable to inhale for people who are smoking. So this could have an effect on the intensity of folks smoking and what exposures they may be getting through that more frequent and intense smoking of these cigarettes. So as we've discussed, sugars have been used in commercial cigarettes for quite a long time, and they are still the most widely used additives. And because tobacco comes from a plant, it does make sense that sugars like glucose and fructose are found naturally in the tobacco. However, sugars are also added to the tobacco, specifically tobaccos that are low in sugar, to make up for some of that sugar that may be lost during the curing process for commercial tobacco manufacturing. So especially for things like burley tobacco that happen to be high in TSNA, they also tend to be low in natural sugars post-processing. So the tobacco industry will actually supplement those lost sugars with added sugars like sucrose or invert sugar, to try to bring some of that level back up, and in some cases potentially even exceed the initial level. They also favor sugars over other ingredients because they are generally inexpensive. They add value to the product by making the smoke more appealing and more palatable, imbuing desirable flavors, and they're also safe. So, according to the tobacco industry researchers, sugars are a safe ingredient. They often note that sugars are, according to the US FDA, generally recognized as safe or GRAS. However, as you've heard, my background is in food science, specifically in food safety. And this argument always bothers me a little bit. So, the industry's use of GRAS as an argument is missing a major asterisk that is tied on to the end of the definition of GRAS. So that is that the substance is generally recognized among qualified experts as having been adequately shown to be safe under the conditions of intended use. The intended use in this case is in a combustible product, and people inhale the smoke from that product. This is not equivalent to oral ingestion, which is what the GRAS status is referring to. So consuming sugars in a food, for example. So the safety of sugars as cigarette ingredients needs to be assessed in the proper context, and referring to the GRAS status of sugars in food isn't sufficient. So with that said, the role of sugars in smoke toxicity is not well defined, and very little academic research has been published looking into the role of sugars in cigarette smoke toxicity. And it's important for us to understand the role of sugars in smoke toxicity because this can help us contribute to tobacco control efforts. So as many of us know, the FDA does have regulatory authority over cigarettes. And the FDA does use scientific evidence in their regulatory decision-making process. So getting a better understanding of the role of sugars in cigarette smoke toxicity can inform their endeavors. So again, going back to my food science background, we generally know that the FDA uses a safe and effective standard. However, we recognize that tobacco products can never truly be safe or free from harm. So in contrast to food, drugs, and medical devices, the FDA uses a public health standard when they're considering ingredients or other components of tobacco products. So this means that the FDA is looking at whether or not modifications to tobacco products or introduction of new products is expected to have any impact on the entire population. So that's both people who smoke and people who do not smoke but may be exposed to smoke. So when we're looking at these modifications like the addition of sugars or sugar levels, we need to consider the impact on public health. So when we're looking at sugars and understanding their toxicity, the goal is to provide FDA with some independent data that they can use in their decision making when setting tobacco standards that are meant to improve public health. Okay, so with all of that said, our main aim is to help generate some of this toxicity data and understanding that can help FDA regulate cigarettes for public health. But we have sub-objectives to help us accomplish this overarching objective of providing public health related data. So the primary research objective that I'll present today is one, to examine the associations between sugar levels in the filler of US commercial cigarette brands, and also the toxicant yields in the smoke. And secondly, to assess the comprehensiveness and scientific quality of the tobacco industry's internal toxicological research on sugars as cigarette additives. So starting with objective 1, which, as I'll remind you, is to look at the association between sugar levels in tobacco filler in US cigarettes and toxicant yields in the smoke. The reason that we're interested in this area in particular is that we know that same thermal degradation process that imparts desirable attributes to the smoke, those caramelized flavors, the aroma, the decreased harshness, the same thermal degradation also generates toxic constituents in the smoke, such as some of those carbonyl compounds I mentioned earlier, like acetaldehyde and formaldehyde. Many of these are known toxicants in their own right, and they impact the respiratory system. They've also been linked to cancer. And then we are also going to be looking at tobaccos which are high in tobacco-specific nitrosamines, because those are frequently used in cigarettes formulated with high levels of sugar. So we do know that sugar levels in the filler of many popular US commercial cigarette varieties range widely, even from those cigarettes that are under the same parent brand. So we do know that a team of researchers that we collaborate with over in the Netherlands has investigated how levels of sugar in cigarettes on the Dutch market affect smoke constituent yields. No such data has been generated for US commercial brands in particular. And as we can see in those brands, there is a wide range of sugar levels. So it's really important for us to look at the sugar levels in those brands and sub-brands and characterize the constituent yields in the smoke to get a better idea of how sugars impact consumers' exposures to toxic compounds. So our hypothesis for objective 1 is that levels of these toxicants are likely to be higher in smoke from cigarettes with higher sugar levels because of that thermal degradation process of sugars leading to generation of some of these compounds. So in order to test this, we picked several varieties of US commercial cigarettes. So we picked these based on data from the Population Assessment of Tobacco and Health Study, Wave 1. So the varieties we picked had to be reported as the usual brand for at least 10 participants in Wave 1 of the PATH study. And this ultimately ended up with 53 different varieties representing 11 major brands like Marlboro, Newport, L&M, etc. And then in our research group, we did have some of the researchers previously assess sugar levels in the tobacco filler for each of these varieties. So from there, I took these 53 cigarette varieties and I collected and analyzed portions of the smoke. So to measure the volatile organic compounds, like those carbonyl compounds, I used a cigarette smoking machine and generated the smoke, trapped it in a glass impinger, derivatized that with DNPH to stabilize the compounds, and then used HPLC to quantify the levels. And then for tobacco-specific nitrosamines and nicotine, I did a very similar concept, trapping or generating smoke and trapping the constituents. But in this case, we trapped them on a filter pad, extract them with aqueous buffer, purified, diluted them, and then analyzed and quantified them using LC-MS. Then from there, we did some statistical analysis, looking at the constituent levels that I measured versus the sugar levels that other folks in our research group had already generated. We looked at Pearson correlation coefficient, so just seeing, is there a relationship between sugar level in the cigarette tobacco filler and constituent yield in the smoke? And then we also did a multivariate analysis using linear mix models to see the role of potential confounding factors. So for this, we had two options that we wanted to explore. The first was looking at constituents on a per cigarette basis, but because these are 53 different varieties with very different design characteristics, we would need to consider factors like ventilation, whether or not the cigarette had menthol, the length of the cigarette, the amount of filler, which we approximate using filler weight, and puff count, the number of puffs taken by the machine when generating the smoke. Or to avoid potential over-adjusting, we could kind of normalize everything by dividing the constituent levels by the amount of nicotine that we found on the filter pads for each of the cigarettes that we smoked. So that would kind of normalize for things like ventilation, filler weight, puff count, and then we would only from there need to adjust for other factors like menthol and length. And this is the route that we ended up going for this analysis. So ultimately, what we found was that smoke constituent levels are positively associated specifically with sucrose and total sugars. So what you're seeing here is a chart of the Spearman correlation coefficients for sugar versus 8 different carbonyl compounds, as well as total VOC levels, and then 2 tobacco-specific nitrosamines, NNN and NNK. Let's see. So these light green bars are fructose. And one thing you can see is that fructose, one of the natural sugars present, is negatively correlated with acetone, acrolein, NNN, and NNK. However, when we look at this deeper blue bar, which is sucrose, which is a commonly added sugar, we can see it's positively associated with essentially all of these different compounds. So what we're seeing is that as sucrose level in the filler increases, there's also an increase in smoke yields of these 8 carbonyl compounds, as well as 2 tobacco-specific nitrosamines. We also see a very similar trend for total sugar. So that's the sum of fructose, glucose, and sucrose in the cigarette tobacco filler. And it seems that this association for the total sugars is largely driven by sucrose, because as you can see, fructose and then glucose, which was not significantly associated with any of these compounds, were not the ones that were driving this relationship. We can really see the positive association is driven by sucrose. And this was confirmed by our multivariate analysis where we did adjust for menthol and length to consider those factors. So this is a table that's showing you the outcome of that multivariate analysis. But what I really want you to see here is this sucrose column. So what you're seeing, especially with the p-values and the asterisks, is that there is still, even after adjusting for potential confounders, a positive association between sucrose and these 8 known toxic carbonyl compounds, as well as 2 tobacco-specific nitrosamines, NNN and NNK. So, to summarize, because I know I threw a lot at you just then, our objective with this study was to describe the relationship between these 3 sugars, sucrose, glucose, and fructose, in commercial cigarettes with toxic smoke constituent yields. And what we found was that sucrose specifically, as well as total sugars, were significantly associated with levels of toxic smoke constituents, especially those 8 carbonyl compounds and tobacco-specific nitrosamines. So this is an interesting result because it does tell us about what kind of exposures people who are smoking U.S. commercial cigarette brands might be having, and how that could be driven by the sugar levels in the cigarette. So this is really essential because we can do all kinds of experiments where we add sugars to a reference cigarette, but we know that people smoking cigarettes, commercial cigarettes, will have very different exposures than what we can approximate with a machine and machine smoking regimens. So this is very, very helpful for us to see what potentially people could be exposed to in a real world situation. Okay, now let's shift to my second objective, which was to assess the comprehensiveness and scientific quality of the tobacco industry's internal toxicological research on sugars as cigarette additives. So for this, we're looking at tobacco industry's internal documents to see what kind of research into sugars as cigarette ingredients, what kind of research they did. So the reason that we wanted to search these internal documents is that we know the tobacco industry historically has conducted their own research into product design to guide their manufacturing and marketing. And this research has historically been fairly extensive. We also know, however, that the tobacco industry does have a history of deceptive communication about what they know about the product and the harms associated with their products. We also know that litigations in 1994, 98, and 2006 against the tobacco industry made many, many documents available from their internal collections, and these documents that are now publicly available include research records. So we are able to actually look through these in an online database. And the types of documents available to us through these public databases include reports of studies, reviews of literature that the industry conducted, records of meetings and other internal communications, and then any other documents that were produced for litigation. So we really have a treasure trove here of internal documents that gives us a little peek behind the curtain, if you will. Another reason that we want to look at industry documents is that academic literature and industry's published literature don't tend to agree on the impact of sugars on smoke toxicity. So when you ask, metaphorically ask the academic literature, do sugars contribute to cigarette smoke toxicity? The answer is yes, probably, based on what we know about thermal degradation and the products that are produced by that, as you've seen with some of that data that I just presented, associating sugars with smoke constituents. However, industry publications in the scientific literature would answer that same question with no, not really. They might increase some constituent yields, but it's not enough to be biologically relevant. So we wanted to see if the industry's internal documents agreed with what the academic literature is stating, or what the industry is stating publicly. So our hypothesis for the second aim is that industry's internal documents will provide us some insight into the scope, quality, and findings of their research on the potentially harmful effects of sugars in cigarette tobacco. So this was kind of a fun adventure for me. It's a type of research I've never done before, which was going into what you might consider gray literature and investigating what we could find. So I started with the UCSF internal document library. So they have all of these industry documents in an online repository that's available for the public. So you can go onto this website, any of you, and search and find whatever you're interested in. And in here, I searched for specific key terms like smoke, pyrolysis, toxicity, sugar, sucrose, cigarette, etc., things that seemed relevant to my question at hand. And then we compiled all of these documents and reviewed them. And something interesting about going into the industry document repository and looking for documents is a lot of these documents contain code words or internal language or things that you wouldn't necessarily expect. So I had to employ what is known as a snowball search strategy, where I started with these key terms that I mentioned on the side. But as I reviewed potentially relevant documents, I would find other search terms that I wouldn't necessarily have thought to use. And then I incorporated those in subsequent searches to better capture the widest range of documents possible. So for example, a word commonly used for, say, cancer or carcinogen would be zephyr. So this is a term you wouldn't expect. It's a code word, but it was something I had to incorporate in my searches as I discovered that that was a word that they were using. So once I had searched and bookmarked all of these documents that initially seemed relevant based on the key term search, we found that there were 968 initial documents. From here, with the help of one of my lovely undergraduate summer interns, we were able to do a key term search within each document more thoroughly and identify which ones were truly relevant based on a more in-depth review. And of those 968 initial documents that appeared to be relevant based on the initial search, about 538 were related to sugar and smoke toxicity upon more thorough review. And from there, after eliminating any duplicates, anything that was actually published in the academic literature, or anything else that was less contextually relevant, we found a grand total of 90 documents that detailed toxicity testing, so methods, approaches, outcomes, etc. So this was, while it seems quite large, 90 documents, about 10% of our initial what appeared to be relevant documents in the beginning. So it was a pretty small range of documents actually investigating toxicity when you consider that there are millions of pages in this repository. We found about 90 documents in total. The focus of the research in these documents was primarily to investigate the differences in toxicity associated with adding varying levels and types of sugars to cigarettes. So frequently what they would do for some of these is add sugars to, say, a reference cigarette or a commercial cigarette, and see how different levels of different sugars impacted the outcomes. And as I mentioned, only a few of the documents that we collected ended up being studies, actual studies conducted internally by the industry or contract labs on behalf of the industry. And many of these documents were repetitive reports of the same studies. So there were a handful of large-scale studies that had multiple documents associated with them. And then many of the documents were reviews of other studies that were done. So after eliminating all of these, we ended up with a relatively small handful of thorough studies on sugars as tobacco ingredients and their effect on smoke toxicity. So again, I have kind of a wordy slide for you here, but what I'm basically wanting you to take away from this is that on preliminary assessment, we saw some general trends in the types of studies that were done, the endpoints that were assessed, and their findings. And then I also wanted to present to you some of the limitations of each of these. So we saw studies like in vitro studies on, say, rodent cells. We saw in vitro Salmonella typhimurium studies. We saw some in vitro and in vivo studies with rodents, live rodents, and then we also saw a few other types of like chemical constituent analysis studies, like the one that I presented to you previously. So these did look at very standard endpoints for regulatory toxicity testing. However, most of them are pretty minimal and have a lot of limitations. So the endpoints were for mutagenicity, genotoxicity, and we know that the industry does have the means, so money, equipment, staff, top of the line methodology to do better than some of these. So a lot of these are limited in specificity. The cell type may not be relevant to human exposure. They may be relatively basic. Some of them test smoke fraction, so the gas phase versus particulate phase separately, and don't actually assess the whole smoke, which we know to be important. For any of the in vivo inhalation exposure studies, they never exceeded 90 days of exposure, which is too short to properly assess carcinogenicity in some cases. In some of the 90-day inhalation studies, we did see an increased incidence and severity of hyperplasia in the nasal epithelium for male rats at a 10% sugar addition level, and also in tracheal goblet cells in female rats at 6.6% sugar addition. So these are important findings. They are showing you some changes in the amount of the cells, for example. But the findings were largely dismissed in the documents. They said, we did see this, but it wasn't particularly important. And then we also know, say, for the genotoxicity tests, some compounds that can be generated by thermal degradation of sugars act by non-genotoxic mechanisms, and there weren't many studies that were capable of addressing non-genotoxic mechanisms of action. So overall, what we're seeing is that there were some studies done, but the depth of the studies for toxicity wasn't great. And unfortunately, when I was looking through this, Philip Morris is now under Altria Client Services. And in 2019, which is the most recent date that I could find information for, the guide of how to do these toxicity evaluations for ingredients and additives like sugars has really not changed. So they're still recommending pyrolysis studies, which are looking at thermal degradation products in the smoke, and smoke chemistry studies, and then also these really basic studies like the Ames assay, so that's using salmonella to look at genotoxicity, a few cytotoxicity assays, and then those short subchronic 90-day inhalation toxicity studies. So really, based on our preliminary findings, the industry's toxicity evaluations lack depth. They're pretty small and non-comprehensive studies that have fairly low relevance to human exposure and key toxic effects of cigarette tobacco smoke. They tend to be limited to rodents and bacteria, so Salmonella typhimurium. The time frame was relatively insufficient. There was as far as I could tell, no evidence from any epidemiological studies or other human trials. And there was no evidence of the use of modern techniques like omics techniques. So we're seeing a lack of depth and relevance in these studies. And we know there are funds available to do more. And then finally, I want to mention something else interesting I found in these studies, which is two different companies taking two very different approaches to the issue of additives, specifically sugars, in cigarette tobacco and the impact of smoke. So Philip Morris in 2001 was primarily investing in studies to support maintaining sucrose levels at the current level used, which was about 6% at the time, and relied heavily on safety information from dietary sucrose. So again, kind of appealing to that generally recognized as safe argument. In contrast, Lorillard at the exact same time was attempting to replace sugars by adding quote unquote desirable aromas and flavors using pre-made carbonyl mixtures. So those same thermal degradation products we were looking at, they were looking at taking out the sugars and adding them directly to the cigarette tobacco. So this is an interesting and potentially creative approach, but you're still keeping an increased appeal, and many of these carbonyls, again, are toxic in their own right. So this tells us, regardless of the approach, we need to recognize that there are negative implications for public health. Replacing sugars could be just as, if not more, harmful if we don't consider the alternative routes taken by industry to maintain the appeal of these compounds. So just something interesting to consider when we're thinking about potential policy and regulatory approaches. Okay, so just to quickly summarize AIM 2 or Objective 2, what we found on preliminary assessment is that the industry studies lack depth and relevance. What a further study of this toxicity research could provide FDA with is some information on potential risks and benefits of policy action for regulating sugars in cigarette tobacco. And it will be important for us as an academic community to provide FDA with independent evaluations of the strength of research conducted by industry on sugars as cigarette additives. And we also will continue to identify potential gaps in toxicological research that academics could study to further inform our understanding in this area. So those were my preliminary findings. A next step would be a systematic assessment of the studies by creating a sort of risk of bias tool assessing context. So what's the importance of the study, the industry study, and what was the hypothesis they were testing. We would also want to systematically look at the design. So was the design suitable to address the study's question? Methods as well, were they relevant to human exposures from product use, and were the studies conducted with a high degree of experimental rigor? We'll also look at the measures being assessed. So are they clearly defined, and are they appropriate for key research questions? We'll consider the results of each of these studies. Specifically, were the statistical analyses performed and interpreted appropriately? And look at also, finally, the interpretation. So are the conclusions and interpretations justified by the design and results presented? So to do this, we are creating our own little risk of bias assessment tool that others could potentially build on when considering industry documents for similar purposes. Okay, so just some concluding comments here. We do really need non-industry research on the toxicological impact of sugars in cigarette tobacco, as both academic and industry research appear to be quite limited. We also know that we need to put greater consideration on adequate, relevant, and modern methods for toxicity studies. A lot of the studies were fairly limited in scope and relevance. And we also want to highlight that it is really important to anticipate potential attempts by manufacturers, as in the example of Lorillard, to replace sugars with other ingredients that may still affect appeal and toxicity. So a blanket ban or cap may not be the answer. We need to take a more nuanced consideration. And lastly, I want to conclude with a quote that I encountered when going through these documents that I think kind of sums everything up perfectly in my mind, which is by Whiteman Varner. He used to be a USDA tobacco expert, and he was quoted saying, "Were it not for sugar, the American blended cigarette, and with it the tobacco industry of the United States, would not have achieved such tremendous development as it did in the first half of the 20th century." So this is an important area to keep considering. And I just wanted to take one final moment to acknowledge our awesome Stepanov lab research team for all their support and encouragement over these past few years for me and all the inspiration they've provided me with. And then a lot of this research branched off of research proposed by a team that our research group is involved with, looking at sugars and cigarette tobacco. So I just want to thank them for all of their help and inspiration as well. And that is all I have for you today, and I'm happy to take any questions or discussion.
Thank you, Ellie. This was wonderful. I've heard this or variation of this talk quite a few times now, but I always learn something new and I'm always amazed of your work. So everyone, please, if you have questions, feel free to drop them in the comment section or unmute yourself and ask the question. And while others maybe are thinking or typing their questions, something that is on the top of my mind that you mentioned it was among the last slides. There are already established risk of bias assessment tool, and the literature search that you've done in the industry documents reminds me a lot on a systematic review process. So I was wondering, what made you think of developing a different type of tool to assess the industry documents, as opposed to using something that is already established and validated? Can you comment on it?
Absolutely. So one of the difficulties with looking at internal documents for tobacco or other industries is that a lot of these documents were never necessarily meant to be published or publicly available. So the standards for reporting and documenting things are very different than what you would see in the academic literature. So a lot of the risk of bias tools currently address a lot of these specific reporting requirements or preferences for academic literature, scientific studies, but that doesn't necessarily match the objectives of the internal industry documents. So it would heavily skew the risk of bias assessment to being a high risk of bias, just because the standards were and objectives were quite different. So we wanted to make sure that we created a tool that is more focused on the quality and conduct rather than the reporting.
Thank you. And while others maybe are thinking or typing again, I have a follow-up on that. Do you see how this can develop further in maybe proposing a set of minimal research that has to be done by the industry, and how some regulatory agencies like FDA can impose certain type of studies that need to be done and completed when submitting some data?
Yeah, it's actually quite interesting. Let's see if I can go back here actually. So the industry, to their credit, did create sort of an approach on how they want to address ingredients and additives as in terms of toxicity. So they actually generated this approach. You can see it's a Venn or a kind of decision tree here, but they started it as a tiered approach that really matches quite well with FDA's approach for food additives. So they look at use levels and potential known risks associated with certain compound classes. and then they decide on the type of testing from there. So they did actually kind of, in a way, again, to their credit, pilot this and try to match some of the regulatory expectations. But I do think that a lot of those expectations maybe need to be shifted, especially as we know some of these tests at this point can be a little bit rudimentary. They focus on outcomes that maybe aren't relevant to smoking specifically and the exposures that way and the specific compounds. So I do think it would be important to kind of build on this, as you mentioned, and see what a more updated model of testing and reporting to, say, FDA or similar regulatory authorities should look like, and what kind of data should be expected. Because again, this is almost identical and it's been decades. Not a lot has changed. So yeah, again, to their credit, they did kind of pioneer this, but I do think it's time for an update.
Wonderful. Thank you, Ellie. And I do see a question in comments. It comes from Dana, and she asks if you can speak to whether it's blend of tobacco in the cigarette or sugar themselves that contribute to potential toxicity. And she's curious if industry documents provides any insight on it.
Yeah, so it's a situation where it's a bit of both. So they do in some situations take, for example, the exact same cigarette, otherwise identical in design features, and add different levels of sugars. So we'll say, just for example, 0, 5, and 10% by weight. And they'll do that for sucrose, invert sugar, high fructose corn syrup, and see if there's a difference. But also in some situations, they added the ingredients to cigarettes in different levels. So say they looked at cocoa and sucrose, but they didn't necessarily isolate sucrose as the variable. They looked at cocoa and sucrose together. So in that case, it could very easily be the blend as well, because they didn't isolate sugars as the single variable they were looking at. So it's actually a bit of both. And they do acknowledge that, say, for like burley tobacco, they're adding a lot more sugar. And they also know that nitrosamine levels are higher in those as well. So it's kind of a mix of both. They know they're adding sugars to cigarettes that may be higher in some toxic compounds, but then they also have some evidence saying it's the specific sugars and levels that are contributing to potential toxicity. So yeah, it's kind of it's not an either or, it's a little bit of both.
Mm-hmm. Thank you. And I see more questions are coming in, and Dorothy is asking, are there differences in sucrose levels in menthol versus non-menthol cigarettes?
Yes. So I can't, without pulling up the data, speak to the exact difference, but I do know it's not as much the levels as it is the variation in the amount. So what we were seeing was that the levels of sugar were less tightly regulated, potentially, in, if I remember correctly, menthol cigarettes. And there's a question of whether or not that's due to maybe the menthol disguising some of the taste and quality of the tobacco and the smoke flavor. So maybe sugars don't need to be so tightly controlled in those formulations, whereas with non-menthol, the sugar range is a little bit more tight. The variability seemed to be less. And that could be because they are trying to adjust that non-menthol cigarette more tightly because they don't have something like, say, menthol to help kind of rein in that palatability in absence of sugars. I hope that made sense. But yeah, it's more about variability, I think, than the actual levels.
Thank you. We have a few more minutes if someone else has a question for Ellie.
I have a question. When you looked at the cigarette brands, they all had like sugars in them, right? Did you look at like a European blend brand or something else that has lower sugars than the American cigarettes to compare?
We actually didn't in this case. We only looked at popular US brands that were purchased from the Twin Cities area in the past couple of years. But that would be a really interesting thing to explore, especially since we do have collaborators overseas in Europe that are looking at a very similar topic. So it would be kind of interesting to compare our findings with theirs. But yeah, for our analysis, we limited it just to popular US commercial brands.
Okay, yeah, because I'd be curious, is it just there's a certain level of these, toxic compounds or carcinogens? How, I don't know. I guess if you had different sugar levels, you can say that it's related, but without having something that had less sugar, how do you know for sure that it's the sugar that's affecting these levels?
Yeah, and that's the really hard part, is isolating the sugar specifically. So we can say it's associated, but we're not certain that the sugar is the cause. Like for the nitrosamines, it's very likely that the sugars themselves aren't impacting the nitrosamine levels in the smoke. It's more that the blend that they're using is higher in nitrosamines and also higher in sugars, just by happenstance. So yeah, like you said, we can't be absolutely certain that the sugar is what's driving it in all situations.
Yeah, thank you.
Yeah.
These were all great questions. Anyone else? Okay, I see something else coming in. So Itoro is saying, since sugar is known to reduce the smoke pH, do you think the industry would have a valued argument if they claim that the addition of sugar is intended to decrease the nicotine uptake delivery, considering tobacco product regulation, toxicology, or industry claims?
Yeah. So that is actually really interesting as well, because in the literature, you will see a very, very common claim that sugars decrease nicotine delivery. So they seem to suggest that the filtration efficiency is higher, I believe. So more, how do I phrase this? Less nicotine is getting through the rod into the smoke and inhaled by the consumer, because for whatever reason, the added sugars traps more of that nicotine within the rod. So yeah, there are situations where they do acknowledge that adding more sugar may actually decrease nicotine delivery, and they think that's a physical result of just the increased sugar in the rod kind of blocking the nicotine from traveling through into the smoke, which I think is interesting, and it's documented in several places in the literature. So they also did a lot of studies that we didn't include because they were out of the scope, looking at an optimal sugar nicotine ratio to allow optimal nicotine delivery while still keeping palatability high. So that's a really interesting question, and it is something that they've heavily considered.
Thank you, Ellie. We are right about at that time. I want to thank you so much for the wonderful talk, and thank you everyone for the engaged and lovely discussion. I want to wish you a wonderful holiday season. Enjoy the holidays, and we will see you back in January.